Mercy here. I am a doctor of nursing practice, a psychiatric mental health nurse practitioner. How are you feeling? I always want to know how you're feeling because I believe that your mood or your feeling can impact your whole being. Let us continue our A to Z series with our B word bipolar that you choose. Now, we are already receiving the C words that you guys have been emailing. We are seeing them and we will talk about a C word of mental illness next week. Continue to email mercy at allmercypic.com or call 682-376-6776 to tell us what you think. Okay? Thank you so much. Now, living with bipolar can pose many challenges. Yet, with proper management, with proper care, it can be consistently managed. You can still live a fulfilled life even though you have bipolar disease. Remember, it is a continuum process. It is a chronic disease. However, if you follow a treatment plan that is made for you, you can live a very fulfilled life with bipolar disease. Some things to take into consideration when you live with bipolar is education. Please take time to educate yourself about the whole process. Gain knowledge into what bipolar disorder is. And even your loved ones around, you can educate them about what is bipolar disease. That way they can better understand you. And not just understand you, you can better make informed decisions about your disease or about your illness. Please try as much as you can to educate yourself about the disease. Now, number two, medication. Some people don't like medication, but most of the time, medication will help, especially medications like mood stabilizers, will help stabilize your mood, will help all those high and lows that you feel, will help put it stable. And please discuss the side effects of medication with your provider, with your mental health provider. Get someone who specializes in mood to prescribe your medication and discuss the side effects of it. Because sometimes the reason why people do not take medication is because they are feeling somehow. So it is not one tailored medication for bipolar disorder. You have different options. If one is not for you, discuss with your provider and find something that works for you. Most of the time, we have seen that mood stabilizers help manage your symptoms and help manage all those mood swings that are associated with bipolar. So, yes, medication is key as well. Also, think of therapy, psychotherapy, and counseling. These have helped tremendously. Therapies like CBT, cognitive behavior therapy, or dialectical behavior therapy have helped tremendously in managing the behavioral symptoms of bipolar. It helps you recognize some of the symptoms. It helps you develop coping mechanisms, coping skills that are associated with day-to-day living with bipolar or day-to-day lives with bipolar. It helps you identify negative thoughts. That way you can modify them or turn them into positive thoughts or just stay away from them. So think about therapy and counseling for those who have bipolar disorder. Also develop a routine and structure. For example, routine sleep pattern. We talk about sleep hygiene already because your brain needs to rest so that your mood can be stable. Develop a routine about when you're waking up, when you're going to bed, when you want to eat, or when you do things. It's not that because you have bipolar disorder, you cannot be flexible with some things. No. But monitor the portion or the part at which or the rate at which you become too flexible. Remember, you have high moods and low moods. You're going up and down. Monitor how your body can process quickly to those changes. If not, then maintain a routine and be flexible only when you can. With those routine, your body and your brain gets into a structure that can better stabilize your mood as you go on. Also important is joining a support network. It can start with your families, with your friends, with your loved ones, and extend to the community. Joining that support network is important, is vital. You guys share wins, you guys share gains, you guys share your down moments, and you learn from each other. You have primary information from each other, and you also share your experience to support the next person. And above all, being in a support network makes you know that you're not alone. You're not fighting this by yourself. You're not alone with bipolar disorder. It's a whole community. Let's us join forces. Like tell your brain, join forces and fight this together. Also, very important is to develop a crisis planning. You can involve your healthcare providers, your family, your loved ones in your crisis planning. When there is a crisis, what do you do? Sometimes we even share vital information for patients to contact us, even at odd hours, if they are going through a crisis. That way we can also direct them on what to do. Do they seek emergency care or do they do XYZ to become stable? And we can even see them before the appointment time just to make sure that we know what is going on and to provide them much assistance that is needed during a crisis. So develop a crisis planning. What to do when I feel this way, who to call when I feel this way, and what is the next move when I am in a crisis. Also, practice a lot of self care. Prioritize your self care. Give yourself a priority. Put yourself a number one sometimes in your behavior. Good sleeping habit, balanced diet, exercise, do things that make you happy, take part in some of your hobbies. You can even include your network in your self-care practices so that you maintain some stability, you maintain happiness. Because most of the time when you do not prioritize self-care, you get so stretched out and so stressed because you've not taken time to take care of yourself. So when you prioritize self-care, it enhances your mood and helps keep your mood stable. Another thing that I like or I would love bipolar patients to do is to recognize their triggers. Please recognize what is it that caused this mood to go high? What is it that caused this mood to go low? What is it that makes me get angry? Recognize those little triggers. Sometimes it may be lack of sleep or a sleep disruption pattern. Sometimes it may be high stress level. Sometimes it may just be life-changing events that you cannot control. So recognize what your body or what your brain does during periods like that. If you recognize these triggers, then you will be able to avoid them or you will be more prepared for them. Some of the triggers you cannot avoid, but you'll be more prepared for them. You can even get someone along with you like, hey, if you see me behaving like this, just pinch me. Because sometimes this thing takes me out of character, takes me out of edge. I need you to remind me that, hey, I am getting there so that I can behave. So when you recognize those triggers, you can better plan. And yes, you can better plan for your mood. Another important factor that I want to stress about, please do not self-stigmatize yourself. Do not self-stigmatize yourself. The society is already looking at mental health with a lot of stigma. I need you to know that you are normal. You have a medical or a mental condition going on, which is being managed. You are normal. Celebrate your wins, celebrate your accomplishments. Bipolar does not define your entire identity. No. You are who you are with a condition that you're treating very well. People manage their symptoms until if they don't tell people that, hey, you see me, I have a manic depressive disorder or bipolar disorder, nobody will even know about it because of the way you're managing your symptoms. So please take care of yourself. Do not self-stigmatize yourself. A lot of things that some people also do is to monitor their behavior, or monitor their energy levels, or monitor their sleep patterns. They use like digital apps to do that. They record it, they keep track of it. And so we have seen them come to our offices with a track of this month, this day, this week, this is what has been happening. And when we know those things, we can better make some adjustments, or some suitable adjustment to their treatment plan, and even to their medications. Why not? So keep track of your triggers. That way you can stay consistently stable, just the way you want to be in a society. So as much as bipolar is a chronic condition, you can live fulfilled lives when it is well managed. Get a professional in that field. Get someone who deals with mood in that field, who specializes with your mood and your feelings in that field, so that they can help you continuously manage these symptoms. You can live wonderful, excellent lives with bipolar disorder. Thank you. Let us wait for our sequel. I am excited. Again, it's been Mercy. Please continue to keep the emails coming, continue to keep the calls coming. It is always a pleasure interacting with you guys. Thank you for watching. Bye bye now.